How much do you know about aortic arch anatomy and right-sided aortic arches? Here's the scoop. The aorta usually arches to the left of your trachea and esophagus, but in rare cases it arches to the right instead. In this schematic diagram, you can see a cross-sectional image that shows an aberrant left subclavian artery that arises from the proximal ascending aortic arch. Join us to delve into this case and to discuss further variants. Now let's go over some schematics from Dr. Stefan Tigges from Radiopedia, which I highly encourage you to check out on your own. So here we see a normal left aortic arch. This next figure here is a left aortic arch with an aberrant right subclavian artery. This is a mirror image, which is often associated with congenital heart disease. And this fourth image here shows our case, which is a right aortic arch with an aberrant left subclavian artery. This is a true vascular ring that can cause compression of the esophagus, which may or may not be symptomatic, as in our case.
So let's see an example of a right-sided aortic arch. This would be Dr. Carl Furman from University of Pittsburgh favorite case. He taught me during medical school, former AMSTER president. So let's take a look. So hopefully you've learned the moguls of the heart, and this one has an abnormal mogul on the right. This should tip you off that we might have a right-sided aortic arch. Okay, let's go to the truth machine. Here's a CT scan. So a couple structures, keep your eyes on trachea and esophagus, and we'll see something going between the trachea and the esophagus from behind. This is going to be an aberrant left subclavian artery, and note the aortic arch is on the right side. So this is going to be a right-sided aortic arch with an aberrant left subclavian artery. The other vessel, got the pulmonary artery there, and then the SVC. So SVC, ascending aorta, descending aorta, pulmonary artery, and that aberrant left subclavian is going to go between the trachea, compress the trachea and the esophagus. And this is a fluoroscopic study, and what I want you to note, here's the esophagus with barium. We have a posterior indentation on the back of the esophagus, but you just have to imagine that aberrant left subclavian artery coming from behind. But this can sometimes cause some narrowing of the esophagus, may or may not be symptomatic. But in the olden days before echocardiography, this was one of the ways they would diagnose what type of right-sided aortic arch you have.